Task Lists, Module 1. The task list is used to identify tasks that nurses need to perform. Based on the particular task, the task list provides the nurse with a direct link to documentation. When an order is generated, if a task is linked to the order, a task will display on the task list. Although most of the nursing units throughout the hospital use task lists, the emergency room does not. Emergency room nurses identify their tasks through icons on the ED tracking board. Tracking board functionality will be covered by your preceptor during your unit-specific orientation. Let's take a look at task list functionality. Select your patient and then click on Task List from the menu. Notice the gray information bar at the top of the screen. This allows you to change the time frame for the list displayed. Right-click, select Change Time Frame Criteria, and then select the appropriate time frame for your shift. Click OK. There are 3 subtabs within the task list. The Nurse Collect tab is used with specimen collection and will be covered in a hands-on session during orientation. The PRN Response Tasks tab displays medication responses and albumin documentation. The All Tasks tab displays both pending and overdue tasks. Let's take a closer look at the All Tasks display. The first column on the left will either be gray or light yellow. If a task is identified by light yellow in this column, it is a chart done or not done task. This means if you complete the task, you would chart that it was done and the task will be removed from your task list once your screen is refreshed. If you are unable to complete the task, you would chart not done, provide a reason why, and sign. This will also remove the task from the list once your screen is refreshed. Notice blood glucose monitor is identified by the yellow column. If you completed the task on your patient, simply double-click to place a green check in the column, refresh, and the task is no longer visible on your list. If you cannot complete the task, right-click, select Chart Not Done, then select a reason for why you are unable to complete the task. Let's select Patient Unavailable. Sign the entry by clicking the green check mark in the upper left-hand corner of the pop-up screen. The task list updates to complete. Refresh your screen to remove the task. There may be a reason to unchart your response to a task. Right-click, select Unchart, provide a reason in the comments section, and sign via the green check mark. Tasks identified by gray in the first column will require some form of documentation to complete. Double-clicking on the task will provide direct access to the documentation for that task. Some tasks will have a specific date and time for completion. Others will display as continuous or PRN. This concludes Module 1.